Good afternoon, everyone. This is Saro Arakelians, your clinical pharmacist. Welcome to another episode of Pharmacy Talk USA. Make sure to subscribe to the channel to receive notifications on daily basis on medication news and updates. First H5 bird flu death is reported in United States. Louisiana's report that a person previously hospitalized with severe avian influenza A or H5N1 illness has passed away. While tragic, a death from H5N1 bird flu in the United States is not unexpected because of the known potential for infection with these viruses to cause severe illness and death. As of January 6, 2025, there have been 66 confirmed human cases of H5N1 bird flu in the United States since 2024 and 67 in 2022. This is the first person in the United States who has died as a result of the H5 infection. Outside of the United States, more than 950 cases of H5N1 bird flu have been reported to the World Health Organization. About half of those have resulted in death of the patient. CDC has carefully studied the available information about the person who died in Louisiana and continued to assess the risk to the general public. So it could be a fatal disease. Most importantly, no person-to-person transmission spread has been identified. As with the cases in case in the Louisiana, most H5 bird flu infections are related to animal to human exposures. Additionally, there are no concerning biological changes actively spreading in wild birds, poultry, or cows that would raise the risk to human health. However, people with job-related or recreational exposure to infected birds or other. The best way to prevent H5 bird flu is to avoid exposure whenever possible. Infected birds shed avian influenza A viruses in the saliva, mucus, and feces. Other infected animals may shed influenza A viruses in respiratory secretions and other bodily fluids. In example would be in unpasteurized cow milk or raw milk. As a general precaution, whenever possible, people should avoid contact with sick or dead animals, in particular wild birds and poultry. For individuals with direct close contact with wild bird or sick or dead poultry or other animals, were recommended personal protective equipment or PPE. Wild birds can be infected with avian influenza A virus, even if they don't look sick. Do not touch the surface or the materials impacted or affected by the animals if there's a suspicion of the virus infection. And again, as I mentioned, make sure to wear your PPE, especially if it's a surface contaminated with the saliva, mucus, or animal feces from wild or domestic birds or other animals with confirmed or suspected avian influenza A virus infection. So again, this is a summary information about the reported H5 bird flu death reported in United States from Louisiana. The patient that was reported unfortunately passed away. So it could be a fatal disease. As of January 6th, as I mentioned, and there have been 66 confirmed cases and 67 cases in 2022. And this is the first person in the United States that dies from H5N1 or bird flu infection. And as these cases are reported to CDC or World Health Organization, they start to investigate to prevent the exposure of other people or patients. And again, for individuals with direct contact to wild birds or sick or dead poultry, make sure to wear your protective personal protective equipment or PPE. Wash your hands. Do not touch the surfaces with bare hand or material and that is in contact with contaminated with saliva, mucus, or animal feces from wild or domestic birds or other animals. This is just protective ways to protect yourself from getting infected by this virus. For more detailed information, comment on the video with your questions, and I'll be happy to answer any questions you may have about H5 bird flu or H5N1 infection. Hope you enjoyed this video. As always, stay safe and take your medications.